I see him as a pioneer because, like other pioneers, he was told, you can't do it. I think his main quality is that if he thinks there's something there, he will continue to work on it as long as he possibly can. That's really what has made him the success that he is. You know, it's the sanctum sanctorum. It is the place where no one's supposed to go until birth. So the hardest part for people were to say, how dare you go in there and do it?
It did seem like the womb was untouchable. Even physiologically, forget the philosophy, even physiologically, we didn't know how to expose the fetus and deal with the amniotic fluid, which of course is absolutely vital. Just many, many little technical things. Those we solved over time in the laboratory. And then eventually, of course, we dipped our toes in the clinical world and did our first fetal cases in women. The first one for us, and still my favorite problem, is congenital diaphragmatic hernia. The diaphragm doesn't form. The guts go up into the chest, and they squeeze the lungs and prevent them from developing. So if you can correct the anatomy, then the lungs can grow. We did a number of human cases, and they weren't entirely successful. It was so frustrating that we had nothing to offer that I came up with another crazy idea, which was, why don't we plug up the trachea before birth? That will expand the lung, so we won't have to do it anatomically. Unbelievably, it worked. And it's practiced even today.
He sat in his office with a lot of sadness. He had misgivings about everything. But in many cases, it was the mothers that he met who said, you know, this is my only chance, let's do it.
And it's astounding to me, even in retrospect, how those women who turned out to be heroic would agree to have surgery on themselves, a significant surgery, and undertake that risk. And that's what they did. And they were absolutely heroic in both undergoing the surgery and then in supporting us and the effort.
I was 22 years old. I was pregnant with my first child and went for my 20-week ultrasound, and I could tell right away that the doctor was concerned. She sent me for a level 2 ultrasound, and they confirmed that my daughter had diaphragmatic hernia. They gave us a 5% chance of survival, and at that time it seemed like the only option was to terminate the pregnancy or to carry it to term, and the baby would basically not survive. And you see all of your hopes and dreams just slipping away when they tell you something's wrong. And so for me, I just wanted to do whatever I could to save her. I found that this doctor, Dr. Harrison, was doing these experimental surgeries. We went to see him, and that 5% chance of survival that my doctor gave me, Dr. Harrison turned it around and said, if you give me a chance to perform this surgery, I feel like I can give you a solid 75% chance of survival for your child. 3 weeks later, that's what we did. So I started the surgery at 25 weeks pregnant and then ended up delivering her at 33 weeks. She grew lungs. She's now 26 and going to nursing school. I actually went on to become a neonatal nurse, and I'm so thankful that Dr. Harrison had it in him to do this research and to save our daughter who would otherwise not be with us. I have what I have. I have my family because of him, and I'm so thankful.
So for some reason, the young people got really interested in this and joined us. And we had the most spectacular class of fetal research fellows over a period of 20, 25 years. The best outcome is those kids who went out and started fetal programs around the world. And they're the leaders of fetal surgery now.
Now there are about 50 fetal treatment centers in the United States. Almost everyone who runs those centers was trained by him. He has created a field of medicine that wouldn't be here without him.